So for my last, I think this is my last slide for professional values. Let's just talk about the marking criteria. Okay. So I know now, you guys, you know what to write on your on how rather how to write on your papers. We will just talk about the marking criteria. Okay. So for possible abuse, so what are the things needed for you to pass? I'll give you a scenario. Let's say the scenario is you are a nurse in A&E, okay? And a carer brought one of their patients in your care, okay? Because the carer said the patient had a fall. After observation, while talking to the patient has learning disability, okay? The patient has learning disability. When you talk to the patient was telling you that the patient is afraid of the carer. Okay. And then when you're doing your A2 assessment, you see a lot of bruises, burns, patient's back. What are the things that we will be doing? So probably you're thinking of possible abuse. So number one is you have to acknowledge the need to escalate the concern regarding safeguarding without the patient consent, reflecting the duty of candor. Of course, if there's like a safeguarding problem with your patient, you have to escalate it immediately. Okay. So in the UK, once you're here, you will be meeting our safeguarding team. So they are in charge of that. Okay. Number two, you have to communicate with compassion and empathy in language appropriate to the patient. Of course, you only use words wherein the patient could understand that. Imagine if your patient has learning disability, of course, you will be using terms or words that they could easily understand. Okay. So that should be included in your answer. Number three, you have to identify the need to act without delay as there's a risk to patient safety and to raise concern at the first reasonable opportunity. So you have to act immediately. Okay, let's say you encounter a possible abuse, of course, you have to alert your senior staff nurse or your manager, and of course, if you guarding team. Okay, because can you imagine the patient is vulnerable, is at risk, physical, mental, emotional abuse. Okay, so number four, to have to raise concern with your manager or local authority. Safeguarding lead in accordance with the safeguarding policy recognizes the need to be clear, honest, and objective about the reasons for concern. Of course, you have to be objective. Okay. Um, Try to avoid bias. Number five, so makes a clear written record of the concern, including a body map and the steps taken to deal with the matter, including the date and with whom the concern was raised. Of course, if you're in the A&E, so probably you might take like a body map. Okay. In other instances, you might ask the medical, say, photographers to take some photos as part of your documentation. Okay. And number six, of course, the code. Everything will be relevant. So that is your prioritizing people, practicing effectively, preserving safety, and promoting professionalism and trust. Okay. So what are any question in terms of possible abuse? Okay, again, guys, the things on your screen are the answers already for the examination. You're just basically rewriting this on that section. So from now on, start memorizing these and try to write it within 10 minutes at home. Okay, hopefully that is very clear, guys. I'm really hoping I'm making your lives easier for the examination. We move on with the last two before we go with your evidence-based practice. So professional and confrontation. So what are the things you have to highlight or write in your papers for professional confrontation? Number one, let's say the scenario. I'll think of a scenario. Um, let's say your colleagues had a fight during your shift. What will you do? Number one. So you have to recognize the importance of allowing the person to talk and vent frustration, showing the interest in what the person says. So you have to identify the problem as quickly as possible, empathizes with the person and offers assistance. Yeah, of course, you have to listen to the person, okay, and empathize to them. Okay. So number two, you have to recognize the importance of number one, establishing rapport. We know that. The use of appropriate eye contact, not staring to the person, of course, and maintaining appropriate body language. So these are the things that should appear on your professional values. And number three, you have to identify the need to remain calm, using appropriate tone and pace of voice. Of course, do not initiate fight with your colleague, of course. Number four, you have to offer an explanation of the circumstance and offers an apology as early as possible where appropriate. Okay, where appropriate. So and number five, document the incident, of course. Offers to refer to senior staff member or the complaint procedure as sign of respect and of taking the circumstance seriously. Number six, you have to take account of your personal safety and ensure that a witness is present. Of course, because at any time, sometimes if your colleague can be like really aggressive, they might punch you. Okay, they might punch you if they're still on the height of their emotion. So if you need like a colleague, another like a chaperone or like a witness, feel free to do so. Yep, they have to make sure to protect yourself and your safety at all times. And lastly, the code again. Of course, everything will be relevant for this scenario. There's a question, Lisa, regarding the criteria. Will it be the same for all exam centers or they have all different? They have the same because all the marking criteria are from NMC. So all criteria are the same across test centers. You will find it on their website instead. If you Google OSCE preparation, it will lead you to Oxford Brook's website and all the papers or the things necessary for your examination will be there. Okay. Similar with other test centers such as Ulster and Northampton. So next, social media. So what, of course, we all know that we have to be responsible whenever you post something on your social media. Okay, remember to think before you click. Before posting anything on your social media. You have to think. Okay, um, so what are the things that you have to write on your professional values? I cannot remember the scenario for this particular um social media thing. But I will read you the possible answer or the answers. So you have to recognize that sharing confidential information and posting pictures of patients and people receiving care without their consent is inappropriate. We all know that. Yeah, that's correct. Number two, you have to recognize professional duty to report any concerns about the safety of people in their care or the public, and the failure to report concerns may bring their own fitness to practice into question and place their own registration at risk, reflecting the duty of candor, of course. We all agree with that, yeah? Number three, you have to then state that acknowledging someone else's post, sharing, reacting, commenting can imply the endorsement or support of that point of view. Okay. So number four, raises concern with manager at the most reasonable opportunity, verbally or in writing, recognizes the need to be clear, honest, and objective about the reasons of concern. Okay. Number five, you have to complete an incident report, of course. Remember, you're posting an information about your patient. That should be reported. And reporting the events, the steps taken to deal with the matter, including the date and with whom the concern was raised. Okay. And lastly, of course, it's the code, and everything will be applicable for this particular scenario. Okay. So that should be straightforward with social media. So the marking criteria, it keeps changing. Okay, the marking criteria keeps changing. So you make sure you have, if you've printed the marking criteria, make sure you have the latest version. Okay, normally for the marking criteria, they change it every 2 months. Okay, so at the bottom of your marking criteria, you will see the version, the name of the version is, I think the current version that we have is version 1.14 or 15, I guess, or 1.5. So if you have the old criteria, throw it. Okay, it's already it's not updated anymore. You might fail because of not following the recent or the latest marking criteria. So make sure to rely on your marking criteria when you're answering your examination. Again, it keeps changing. So what I'm telling you now might be different on the day of your examination. So make sure you check your marking criteria every now and then because it keeps changing. So that is your professional value. Any question in terms of professional value? I hope